Hi class, my name is Kevin McBride and I wanted to share with you the disorder that I picked. It's called Williams syndrome, and this is something I have personal experience with. I have a friend that I've known for probably 15 years. He's an amazing individual, but he has Williams syndrome. And this is one of those things that he's been able to enrich my life, and I ultimately credit him with putting me on the path that I'm following now. So I hope you find this enjoying and as interesting as I found my friend to be. Now, the history of Williams syndrome um, starts with a New Zealand cardiologist named Dr. John Cyprian Phipps Williams. And in 1961, he is credited with discovering Williams syndrome. He was followed shortly later in 1962 by the German physician Dr. A.J. Buren, who reported similar findings. And as a result, Williams syndrome also became known as Williams-Buren syndrome. And then in 1993, Dr. C.A. Morris discovered the genetic component, which is really the ultimate identifier of Williams syndrome. Now, Dr. Williams, in his work, he observed 4 patients with supravalvular stenosis, which is a narrowing of the aorta right above the heart. He noticed that these patients shared a mental disability and had similar facial features, such as a broad forehead, low-set drooping cheeks, widely spaced eyes, and a wide-set mouth. Dr. Buren, shortly after, observed 3 patients with similar characteristics. And in 1975, we had the first large-scale study on Williams syndrome, which observed the behavioral and physical symptoms in greater detail. And this study basically laid some of the groundwork which previous studies have relied on. And now, thankfully, we have quite a bit of information on Williams syndrome, and it is a widely studied disorder. The traditional way to diagnose Williams syndrome was through physical characteristics and their personality characteristics. Now, this has caused a lot of problems for obvious reasons. The first and foremost being that you cannot get a proper diagnosis until the child is probably over 5 years of age, because a lot of people with Williams syndrome will speak at a later date, and this can basically inhibit a proper diagnosis. But so a lot of people before the advent of genetic testing might have been misdiagnosed with something like a intellectual disability, or possibly even with Down syndrome. Now today we have much better technology, and we have more resources, and we can earlier identify Williams syndrome. Now, some of the things that that will help lead to a diagnosis of Williams syndrome today, we can check in utero by either using an EKG or ultrasound. And the EKG and ultrasound, what they're looking for are heart defects, or basically a heart rhythm that's not where it should be. And you can also, another sign is abnormal kidneys, or kidney defects, or abnormal blood pressure. But the first real way that they were able to definitively test for Williams syndrome has been by genetic testing. This is the most accurate method to test for it, and it is basically 100%. It'll give a 100% diagnosis, because Williams syndrome is essentially a genetic disorder. Now, the ultimate cause of Williams syndrome is caused by a deletion of the long arm and chromosome 7. Now, I don't really understand this. I'm not a geneticist, but it's basically meaning that there's some genes that are deleted or are missing inside of a chromosome, and this deletion ultimately causes Williams syndrome. Now, Williams syndrome is a rare disorder, and it affects between 1 in 750,000 to 1 in 20,000 births. So we don't really know the number an accurate number that it affects, because these numbers are for basically a Western world, or basically people that can get genetically tested for it. So the numbers are still a little up in the air, but it's still extremely rare, and it affects both males and females equally. The characteristics of Williams syndrome varies a great deal from individual to individual. Some individuals with Williams syndrome will have some of the traits of the disorder, and some will have all of the traits of the disorder. And the severity of those traits will vary from individual as well. And researchers have observed patterns of growth and development and specific neurodevelopmental profiles involving 4 key areas. Their cognitive development, language, auditory function, and visuospatial function. Now, to start with some of the physical characteristics of Williams syndrome, it's typical that children with Williams syndrome have prenatal and postnatal growth delay, and this is usually described by doctors as a failure to thrive, or they are in a lower percentile height and weight wise than their peers. So short stature is common, and these children are usually shorter than what their family background would suggest, how tall or how much they should weigh. And adults often reach a mean height that is often well below the 3rd percentile. There's also a history of feeding problems and poor weight gain. That's very common. And there is a history of visual disturbances, which is possible. These are mainly related to astropia, cataracts, and hyperopia, and this can affect as many as 50% of individuals with Williams syndrome. Now, just to relate to my friend with Williams syndrome, he is shorter than his family history would suggest. Both his parents are very tall, and so him being a shorter height is a little unusual, but still he's probably about 5'8" or something like that. And he's also skinnier than most people his age, so he doesn't weigh that much. And he's never had any problems with cataracts or any of the eye problems, but he does wear glasses. So some of these things are accurate, and then some are not exactly accurate for my friend. A history of congenital heart disease and hypertension is common, and there can also be abnormally increased levels of calcium in the blood during infancy. This is called infantile hypercalcemia, and there can be a history of delayed bone age, connective tissue abnormalities, failure to gain weight, and low muscle tone. As well as those, there can also be hernias and kidney abnormalities, and some of the other physical characteristics include a hoarse voice and hearing loss. Now, with the congenital heart disease and hypertension, that's related overall to problems with the heart, and I will discuss it more in detail later, but many of the people affected by Williams syndrome will need surgery to correct a heart problem later on in life. And this is true for my friend too. He had surgery on his heart last year. Luckily he's doing great and everything's fine, but this is something that is very characteristic of people with Williams syndrome. As I discussed with you about my friend, some of the medical complications that can arise, the number one being congenital heart defects, and they occur in approximately 75% of children with Williams syndrome. So this is extremely prevalent and extremely common. And the most frequent defect is supravalvular aortic stenosis, which is a condition characterized by the narrowing of the aorta above the aortic valve, which I discussed previously. And this condition may be progressive in some individuals, and lifelong cardiac follow-up is recommended. And out of these, surgery is generally required in 20 to 30% of patients. So, and these medical complications with their heart generally gives them a shorter life expectancies than normal. The life expectancies can vary wildly from 25 years old to past 60. But with the changes and increases in our knowledge of how to fix someone's heart, the life expectancy of people with Williams syndrome has increased as well. Now, there are some facial characteristics that are very closely associated with Williams syndrome, and virtually all children and adults with Williams syndrome will have some combination of these facial features. And some of the facial features include a short upturned nose, a flat nasal bridge, a long philtrium, which is the space between your upper lip and the base of your nose, basically where a mustache would go. They would have flat cheekbones, a wide mouth, full lips, widely spaced teeth, a small chin, prominent earlobes, and puffy eyes. Now, that being said, not every person with Williams syndrome is going to have all of these characteristics, but it's very, very prevalent that they would have some of these characteristics. And this is a picture of a young child with Williams syndrome. And I put this on here so you could kind of see in greater detail what some of the facial characteristics are like, and then also how we can see that this child doesn't fit all of those characteristics as well. So this child, you can see that he has very kind of big, puffy eyes. He has a quite a large gap from the bottom of his nose to his upper lip. His lips are very wide, or his mouth is very wide, and he has very full lips and large earlobes. But he doesn't have the small chin, and his cheekbones aren't necessarily flat. Now, my friend with Williams syndrome shares a lot of the same characteristics as this child in this photo. So the facial characteristics in Williams syndrome are very prevalent, and it's kind of hard to miss some of these things if you see someone with Williams syndrome or you know someone with Williams syndrome. Now, the cognitive abilities of people with Williams syndrome varies widely from individual to individual. Developmental delays and intellectual disabilities are very common. And a study in 2007 of 306 children that have been diagnosed with Williams syndrome reported a mean IQ of 69. So, and the majority of these cognitive studies have described a fraction cognitive profile. So, and these traits are, they have a relatively intact language and facial processing skills, meaning that they're very verbal and they're able to read people's emotions just by faces. And in fact, as infants, most of these infants will communicate through facial expression because their language has been delayed. Most of them don't learn how to speak until they're roughly 4 years old. So, and another thing that they share is there's a profound deficit in visuospatial abilities. Now, along with some of the cognitive difficulties that a person with Williams syndrome would typically have, they also have some cognitive strengths. And one of these strengths is in their verbal short-term memory and also in their language skills. So some studies have suggested that individuals with Williams syndrome, they display typical, although delayed, skills in the areas of language development, complex syntax, semantics, word fluency, expressive vocabulary, plurals, irregular past tense, and mean length utterance. And along with this, their language development appears to be atypical in their grammatical comprehension, gender agreement, pragmatics, oral fluency, and reciprocal conversation. So this is something that is pretty common. Now, my friend with Williams syndrome is extremely verbal, extremely talkative, and is very, very good with language. And you'll see that with a lot of people with Williams syndrome. And people with Williams syndrome also may have certain musical abilities. and it's been asserted that their musical skills surpass their cognitive level, and that their musical interests, creativity, and emotional reactions to music exceed that of most people. And that is definitely true with my friend as well. He plays the drums. He is incredibly interested in music, and he has played music um, ever since I've known him. But it's kind of one of the defining parts of his personality, and which is really awesome to see him do. Now, probably the biggest um, impact that my friend has had on me has been him showing me like his social strengths, and this is a trait shared by other people with Williams syndrome. They tend to be very friendly, excessively social. This has been described as a cocktail party personality, which I think is a great description of um, how they how they interact with other people. If you think of someone who's at a cocktail party and they float from people to people, having conversations with everybody, and this kind of makes them an endearing personality, if you will. They can also be extremely enthusiastic, very expressive, and sensitive to others' emotions. So they're always worried about how other people feel. They will let you know how you feel. With my friend, this has probably been one of the um, most important parts of our friendship, is because he's able to tell me exactly what he feels, and in a way that in most conversations with people you never get to that level. But with him, it's always you talk to him on a deeper level about who he is and what he feels. And another social strength is they have a great memory for faces. Now, these social strengths that someone with Williams syndrome um, would most likely have, and which are the probably my favorite part of the personality of someone with Williams syndrome. These strengths also come with related weaknesses. This means that they may be unafraid of strangers and unafraid of not knowing if maybe somebody was basically not good for them or maybe out to hurt them. They also have trouble connecting with their peers because of this personality, in that they'll come up to people and start having conversations and basically not follow the, I guess, norms of etiquette and as far as meeting people. And this can turn off some people, which is a real shame. They also can show a greater interest in adults rather than their peers. Um, and if you meet someone with Williams syndrome, I think you would understand why. They are very interested in you, and they kind of have like grown-up conversations. Um, they're more than 4 times more likely to be diagnosed with ADHD. Um, they may suffer from severe anxieties and phobias, which is very common. And along with trouble connecting with peers is comes depression. I know that my friend has struggled with depression, and it's been related to things that he can't connect with peers his own age, and this has been very hard for him. And other people may have um, maybe kind of been afraid of him, or because of his personality, and it has been a real shame. And it's horrible to have to hear him talk about how he's depressed because he can't connect with people, and inside that he's an amazing individual, and if other people saw that, then hopefully that they would make that connection too. Now, it is extremely common for a person with Williams syndrome to have deficits in their visuospatial skills. So they may have problems with perceptual grouping, orientation discrimination, mental imagery, spatial relationships, and spatial memory. This means that they might have problems with handwriting, um, or difficulty math, especially geometry, and they may have problems with like abstract reasoning. So these are some of the things that their affect them, can most affect them in school, and are some of the hardest things for them to overcome in a lot of cases. Now, the strengths in language that I described earlier, they are relatively late in coming for a person with Williams syndrome. Typically, as a child or an extremely young child, they might communicate with through facial expression or eye contact or gestures. And single words and phrases generally don't come along until 18 months or later. They'll build sentences in around 3 years, and they'll finally build strength in language in about 4 to 5 years. Now, as they get older, people with Williams syndrome generally have very high vocabularies. So that's true with my friend that I have. He's extremely expressive, has a very extensive vocabulary. They may have difficulty finding words during stressful situation or have articulation issues. They may perseverate on a topic that is common, or use unusual words and phrases, and some might have difficulty understanding other people's perspectives or use speech in unsuitable contexts. Now, some of the auditory problems associated with Williams syndrome are hyperacusis, which is an increased sensitivity to everyday sounds, or phonophobia, where children become worried about noises, and typically both of these things improve with age. There's also a common or a typical element of hearing loss in people with Williams syndrome, and also a love of music, which I described earlier. Now, there is no cure for Williams syndrome because it is a genetic disorder, and people with Williams syndrome will need medical care generally related to their cardiovascular complications throughout their life. One recommendation that is given is that they should avoid taking extra calcium and vitamin D to prevent them getting higher blood calcium levels. And some of the treatment that would best help them are special education programs, and particularly developmental and speech therapy. These can help deal with some of the developmental delays, and they can also benefit greatly from social skills training. So that is an important piece in helping someone with Williams syndrome, because of their many of their problems are related to their inability to interact with other people. Now, as far as independent living goes, most adults with Williams syndrome can gain employment in a wide variety of settings and can perform their own self-care tasks. Some adults with Williams syndrome will require the daily care of either parents or caregivers for the rest of their lives. However, others may live with less supervision and care. But few adults with Williams syndrome live entirely independently. My friend with Williams syndrome, he has a job, but he still lives with his parents. And whether he could become fully independent, I don't know. I think that would be a very tough task for him. But I think generally people with Williams syndrome will need some sort of combination of care and supervision, along with the ability to gain employment, go to school, and these sorts of things. Now, some of additional resources, if you guys are interested, the largest is the Williams Syndrome Association. It'll provide information on the disorder and also connect people to resources that can help them and educate others about Williams syndrome. The other is the National Organization for Rare Disorders, and this is a combination of a lot of rare disorders, but it has a pretty extensive information on Williams syndrome. So both of these are excellent resources. I would suggest, if you're interested, checking these out. Now, here's my reference pages. The ones that I found most interesting were the ones that dealt with personality profiles and traits of an individual with Williams syndrome. There are other references that have things like they would help out someone who works with people with cardiovascular problems, or even speech pathologists. So there's a lot of information on that. But this is a fascinating disability that has really enriched my life personally, and I hope you guys get a chance to meet someone with meet someone with Williams syndrome someday, and because I think that they are exceptional people, and there's no way that you cannot have fun with somebody that has Williams syndrome, because it is amazing. So hopefully you'll get somebody like that in your classes someday. But other than that, thank you for watching my my video, and I hope you guys have a good day. Thank you.